Well, hey, I am Sarah, and welcome to the Your Health Matters podcast. Today, important topic talking about why it is so beneficial and important to establish care with a primary care physician. We have with us today from Summa Health, Dr. Suttles. Thank you so much for joining us.
Thank you for having me, Sarah.
So, I really feel like we're in an era of urgent care, express cares, pharmacy clinics, on demand health. And I've recently seen that multiple studies have shown that only 68% of millennials have a primary care physician, and only 40% of Gen Z patients visit their primary care provider once a year or even never. Millennials are almost twice as likely as baby boomers to use retail and urgent care clinics. And they are also more likely to self refer to a specialist than previous generations. What are your thoughts on this trend and why the younger population are not seeking primary care?
Well, those are your first generations that really use the internet, and are very big on social media. We have Instagram and, all these right now in the moment type of ideals when it comes to anything, any service oriented type of service people can get. You can shop online. So why can't I see my doctor online? Well, can I schedule online? And so those are the things that healthcare, I feel, were a little slow to come into what the need was until the pandemic happened. And so once that happened, it kind of forced our hand when it comes to healthcare. You don't no longer have to wait on the line and call to get scheduled to see a doctor days and weeks or even months from now. You can kind of go online at your convenience and schedule an appointment to see a doctor same day or within the next 24 to 48 hours.
Yeah, I think it kind of forced us all to move light years ahead in technology. But that's a good thing. And I guess I want to know, what's the benefit of having a designated primary care physician?
It's kind of like, to me, I tell people all the time, when you develop a relationship with anyone, you want to know the history. You want to get to know and familiar with your doctor as well as your doctor wants to get to know and be familiar with you. It's about relationship building. I specifically want patients to seek out someone that they feel comfortable with. It's one thing to go to a doctor when you're sick, like in urgent care. They don't know you, they don't know your family, they don't know any history about you. You're sick, they want to make you feel well. And then what is the final sentence they always tell you? Follow up with your primary care physician. So I'm here and we're here so that you can have that history so that when you do get sick and you can't see us, well, you can always come back to us and we can always reference things that we already know about you. We can learn about behaviors you have that are good and bad that contribute to your health overall so we can have better outcomes in our life.
It's just like maintenance, I feel like, right? You take your
Yeah,
car in for maintenance, you do, you maintain your house,
correct.
you gotta
Cor-
maintain your body too. I feel like there's so many like checkups and different testing as we age that I don't know that I would necessarily know about unless you go to a primary care physician.
That's correct. I mean, just today, speaking with a mom and daughter, I'm a family medicine trained physician. So I see um, patients from the womb to the tomb, whatever. So I see everybody. And so I saw a mom and a daughter today. And so just something as simple as menstrual periods, let's bring that up, menstrual health. You have no idea that there is a time limit to starting. You know what I'm saying? You just like, oh, I don't want that to happen. Like put it off as far as you can, doc. Like, no, but if it doesn't start in a certain time period, I, as your primary care physician, should be looking for some underlying causes to that. As a parent, you don't know that. You know what I'm saying? You just know I'm asking questions every year. You don't know why I ask those questions, but they all have some type of importance to your overall health.
And to that, I love that you being a family physician, that you can know different things in that particular family history. You
Correct.
mom, and then because some things, I'm sure can run in the family. And I think that's so great. And I think, I don't know, from just my friends and my family, I think the hang up sometimes with people is they think, well, I'm healthy, I don't need to see a doctor. But this is really generally healthy people. We all need a primary care physician and to do that maintenance that we just
Mhm.
talked
Well, you're healthy until you're not. And
about.
so if you have, health insurance, typically your annual wellness exam is a covered expense. So I always tell people you're paying for it anyway. So you might as well come in and see me. Let's get to know one another. And then from there, we can determine your schedule, your particular schedule on your health goals. I mean, you can come in and not have a goal and leave here saying, well, then I didn't know that my BMI was elevated and I'm facing, obesity and the things that come with that. And I really need to, get my exercise and diet in check, for instance. So there's always something to improve upon. And if your doctor is overlooking your care, you're more aptable to come in and see me once a year at the least.
I want to ask you this too, because this is something else I also hear. And I think maybe, it isn't for everyone's scenario, but have you heard the white coat syndrome, I think they
Oh
call it?
yeah. Uh-huh.
People are afraid to go to the doctor.
That's once again picking somebody that meets your personality. It's somebody for everybody. When I go see patients, I got this white coat on for you today, Sarah. I usually don't wear a white coat when I go in to see patients. They see me as me, whatever. I come in, and because we have an established relationship, I can come right in like, hey, tell me about that trip you just had to Jamaica, a couple of weeks ago. Or if I've never met them, tell me how can I help you today? Just a simple open-ended question so we can kind of establish what our goals are. So there is some white coat, every time I go to the doctor, I'm going to get some bad news. Not necessarily. Not
No,
necessarily.
that's so good. I love that. That's such a great point about establishing that relationship.
Hmm.
We talked a little bit earlier about the younger generations and how, things have changed and they're change in the future, I'm sure too. And we have to keep evolving. Younger generations want something quick.
Hmm.
You talked about that earlier with social
Hmm.
media things. How has healthcare, do you see, really adapted to that?
So there's something called open access. So if you think about back in the day when your parents may have made an appointment to see a doctor, it was, you call in, the staff will take an appointment, you'll have appointment in the next coming weeks or so. Open access allows us as physicians to leave some space available on our schedules for patients who want to be seen today. Now, what does that mean? Sometimes it means you may not see your primary care physician, but you can see a physician to see you at that given moment. And depending upon what the ailment is, you don't care. I don't feel well. I just want to get in and see somebody. But as your primary, I want you to be able to see me. So in my schedule, I create pockets of time for patients of mine that may call in same day. Same day means that schedule may open tonight at 5 p.m. for people to come in tomorrow. Or today, for instance, I can look at my schedule. I can look at my schedule and see where I want to fit extra people in that may call in. So I put those in my schedule. So we have some flexibility now with our healthcare templates and how we see patients. And so we try to do our best to see our own, but if not, there's others that can take care of our patients for us.
And how do you suggest someone to maybe start the process of finding a primary care physician, like you said, that really fits with them and they vibe well together?
Well, most of my patients come to me by word of mouth. So, they have loved ones that see me. I may see a grandmother and then they niece bring them to the appointments, and then now I'm seeing the niece, and then they just referral by mouth. It's just good common rapport with families that say, hey, won't you go see my doctor? But if you don't even have a base to start, you can start by calling like your insurance company and asking them who's on my panel to see that's in my area.
That is perfect. Well, you had great advice for us today. And I hope this serves as a reminder for everyone. Sometimes you just need to have that little nudge, like, oh yeah, I've been meaning to do that. I'm going to call today. And I'm,
Yeah.
so thank you. You're just a pleasure to talk with.
Thank you.
Learned a lot. So I wanted to go and do this today. If you've not established care, go to summahealth.org/primary primary care. They offer a physician search tool as well, just as you mentioned. So get that on your to-do list. And once again, thank you for joining us.
Thank you for having me.